This is a podcast from News Talk Radio 710 WOR. Now on News Talk Radio 710 WOR, here's Joan Hamburg.
Let's take a quick break because we're going to save you a lot of money on your health care. I'm Joan Hamburg. 21 minutes before 2 o'clock. Joan Hamburg with you. And I always give you the phone number because I love when you participate. 1-800-321-8828 is our phone number. So, I had mentioned that my daughter and a bunch of her friends were talking about the President Obamacare, health care. And it didn't matter what political persuasion they were. A lot of them were pretty excited. They said, this will resolve the health care thing once and for all. But there are more delays. The Medicare cuts, that was till after the election. The employer mandate delayed. And then there was another story which Forbes actually caught, an announcement that the administration would delay enforcement of a lot of key eligibility requirements for the health insurance subsidies relying on the honor system. And now another one. Caps on out-of-pocket insurance costs are going to be delayed for another year. How can you save money on health care? Not really easy. Barbara Fonti is my guest. Barbara is founder and CEO of the Fonti Group, which is an insurance and consulting company, and they specialize in employee benefit solutions. Welcome, Barbara. Happy to have you visit today.
Thank you, Joan. Thanks for having me.
No, and healthcare costs, it's no secret. They're totally out of control. I met a woman just the other day. She's a manicurist, and she got Bell's palsy. Or she didn't know what it was, but I had it, so she thought she knew that's what she had. Woman in her 40s said, you got to go to a doctor. No health insurance, I'm not going. I said, you don't know what the heck that is. You must go. But this is the story we hear time and time again. Can't afford to get sick, not going to go, going to tough it out. Health insurance costs are really out of control. So talk to me.
Yeah, they are. And it's very sad when you hear stories of people, whether they're sick or not, and they don't have health insurance, because, sooner or later they're going to need to go to the doctor, the hospital, and it can cause a real problem for them. And then there are those stories of people who have health insurance, and it's just
can't
not enough.
Get it, right.
Yeah. So there are a couple things out there, though, we need to share with everybody, because there is a little bit of good news out there. First of all, let's talk about that lady, the 40-year-old that doesn't have health insurance.
Right.
Yes. Now, we do hear that there are some delays in health care reform. However, many of the new marketplaces that are going to provide some discounted premiums on health insurance are ready to go. And those are going to be available for individuals and small business owners to go online and compare health insurance plans and prices. Each state is going to have its own marketplace, but we've seen the numbers come in states like New York, for example, where this marketplace is creating great excitement in the insurance business, and there are actually 8 additional insurance companies who've come out and said, hey, we want to be part of this, and we now want to offer options for people. And that's creating some competition, which is driving some of the prices down. So for folks who have never gotten health insurance, or they don't have health insurance now and they feel that it's very, very expensive, this is going to be a great way for them to see some discounts. Additionally, the government is offering some tax credits. Those tax credits, you might hear them called subsidies.
Right. I heard they're going to be available in the fall, but who knows?
Yeah. Well, they're set to be available. The marketplace opens up October 1st, but you're actually not going to get that credit until January 1st, 2014.
And what's the deal? Who's eligible?
Okay. People are eligible if they do not have the opportunity to purchase health insurance through their place of employer, Or if they do have that option at work, but it's considered to be too expensive for them, and I'll tell you what that criteria is in a minute, they can go online and they can purchase their insurance. Now, they will receive subsidies if their household income is under a certain amount, and that amount is 400% of the federal poverty level. So what are we talking about?
What's the federal poverty?
Yeah, we're really talking about if they're making less than $40,000 a year for an individual, or let's say an average family of three is making less than $70,000 a year.
Hard to believe, but they can't live on that today, right?
They can't. Not, I tell you, not on the East Coast anyway.
Yeah, it's tough. All right, so that's interesting, and that's something that people should check out.
That's right, exactly. And, there is an option also for small businesses under this marketplace. For businesses that have 50 or fewer employees, they can use the marketplace as well. And for the real small business person with 25 or fewer employees, they may actually qualify for tax credits for the business as well.
Wow.
In that market.
Okay, but you really have to do your homework. And you know what I find, Barbara, and you're an insurance expert, you have your own company. Most people have no clue and don't know whom to ask advice from.
Absolutely.
How do you really find this stuff out?
Absolutely. And not only do they not know who to go to, they don't really want to know. I mean, everybody's busy with their family and their work. Insurance is something people kind of check out, I think, a little bit. They turn the light off. They don't want to deal with it. But there are a lot of resources out there for folks. They can go to their local health insurance broker or an insurance professional if they wish, or if someone searches online for their state Department of Insurance. Every state in this country has a Department of Insurance that governs rules and oversees all insurance professionals in that state. So if you do a search for the Department of Insurance, or if you don't have a computer, you can dial 411 and ask for the number. They usually have an 800 number. You can ask to find a qualified representative that's in your local area to speak with. We have a lot of folks that come to us from all over the country for this information. We have a newsletter that we send out every month to give people helpful hints and keep them up to date with what they can do. And the government has also put into place something called a Navigator program. And the Navigators it's a nonprofit organization that has employees that are being specifically trained now to help people maneuver and navigate through the marketplace. So they're navigators. And online you can see a list of navigators as well and find one closest to you.
And with the president, so many aspects of this plan, Obamacare, being delayed, what is going to happen? Like I said, my daughter's friends were all saying, our health care is so expensive, we're going to be able to have Obamacare, regardless of what political affiliation they were.
Right, exactly.
Who's going to get health insurance and when?
I think they're still going to get health insurance. The big delay that we've heard about has to do with penalties for businesses that do not offer health insurance options. So perhaps that will delay some business owners, some corporations, from offering these health insurance plans that they might have offered January 1st. They may wait till January 1st of 2015. But there'll still be options for individuals to go get health insurance if they want. And there are a number of different aspects of the Health Care Reform Act that are currently in place that are not delayed, that people need to know about. For example, I think a big mistake people do now is they pay unnecessary co-payments. Under the Affordable Care Act, most of those just annual checkups people go for and screenings people have, there's no co-payment anymore. So
is that a done deal?
That's a done deal.
Is that for everyone?
That's for almost everyone.
Who's excluded?
You want to go in network. If you go out of network, you may still have to pay a co-payment. And there's a very small percentage of health insurance plans that are considered grandfathered and do not have to comply, but it's a very small percentage. If any of the listeners are not sure if they're in a grandfathered plan, best thing to do is either contact your insurance carrier or ask your employer. But for everyone else, there are all these co-payments that people are still paying that they don't have.
No, they don't know.
Right, exactly. So, that could be everything from immunizations for the kids to cancer screenings and blood pressure and cholesterol tests and even things you might not think of, like obesity screenings and counseling or behavioral assessments for children under age 18. There's a whole list of them that, we can provide to anyone, and there's also a website that the government has called healthcare.gov. that provides a list of these. But here's the problem with the delays, Joan, is that every time we hear about a potential delay, all it does is create a situation where people are not taking this legislation seriously.
And they have to.
Yeah, and so people, if you go to your doctor's office and let's say you have an annual checkup and they ask you for your copayment, it may be that doctor's office doesn't realize that they shouldn't be charging for that anymore. And they may not realize it because people have not taken this law seriously.
Well, first of all, how many doctors do we know today that won't take any insurance? But you know what? I wish we had more time. Barbara Fonti, founder and CEO of the Fonti Group, Insurance and Consulting. Your tips to save money on healthcare, is that available online?
Yes, it is. Anyone can go right to our website, www.fontigroup.com, and they can get a free download of a lot more tips even to save them money on their health care.
I thank you so much. All the best to you, Barbara. Good information. I'm Joan Hamburg at 10 minutes before 2. We'll continue our conversation after this.